Hello, and welcome to the Talking Apron podcast. We are your no-nonsense friendly resource for healthier eating and confident home cooking, especially if you're working to manage or prevent diabetes. I'm your host, Anne Bernardin. I'm a certified diabetes prevention coach, a nutrition educator, and I live with type 1 diabetes. So first, before we get started, water. Go ahead and go grab your cuppa, because water is the foundation for good health. So this episode is titled Kiwi Kickstart, a sweet boost for blood sugar balance. Who knew? We are going to be covering how we can tame any type of blood sugar spike, the vitamin C portion of kiwis, how it helps with digestion, and also how to buy and store kiwi. So fruit is high in sugar. Won't it spike my blood sugar? Is that a question you ask yourself? Well, let's not forget that fruit has so many benefits in the form of micronutrients, vitamins, minerals, and water. One medium kiwi has 10 grams of carbs, 2 grams of fiber. Now that's if it's peeled. It's close to 4 grams when it is unpeeled. And yes, the peel, of course, it's edible. It boosts your folate by 32% when you eat with the peel, and your vitamin E by 34%. So, in addition, if you're familiar with what glycemic load is, kiwis are very, very low. It has a score of 3. So don't be afraid. Pair it with almonds or a piece of cheese to slow that absorption even more. And that'll help you dodge that post-meal spike. So did you know when diabetes progresses and your average blood sugar raises, that's usually an A1C of 7 is about 150, and then you go to 80, and that's about 200, and it just keeps going up. When your average blood sugar raises, your healing takes longer. Think paper cup cuts in your fingers that just won't close or heal, knee scrapes that consistently have a scab. You know, if I get into it, when your A1C is high, some doctors will not perform surgeries because they know you won't heal. Think knee replacement and hip replacements. If your immune function is low and you're having a hip replaced, or if your healing is low, which again is those immune system coming out to say heal, 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 it takes longer and it's more dangerous. So there are certain doctors that are now requiring that you have a lower A1C, under like 7.4, 7.2, some are going under 7 before they will actually do the surgery. And now what does that have to do with kiwis? Vitamin C. Vitamin C helps us heal. And kiwi delivers 64 milligrams of vitamin C. That's 70% of our daily requirement. That is more than an orange, and kiwis have more potassium than a banana, with lower the carbs. So consistent intake is critical of vitamin C because that helps with the repair of all things going in our body. Now, let's get back to the information of eating it with the peel. Okay, I'm a nutrition educator. I talk about things that go in the mouth and come out the anus, and that is poop or waste or bowel movements, fiber. So when you eat a kiwi with the peel still on, you have increased your fiber. And why do we want to do that? Well, if you can't hit your fiber target, know that 2 kiwis is almost 8 grams of fiber with the peel on. And it has this extra boost of an enzyme that helps ease the protein digestion. It's kind of like that pineapple piece when you marinate. So adding diced kiwi to your oatmeal or to smoothies, you get a happier gut and you get steadier blood sugar numbers. That's what kiwis is about. And I bet you're thinking, yeah, but when I buy kiwis at Costco or Sam's Club, they always give me about 12 kiwis. And what do I do with them all before they go bad? Yes, kiwis can go bad before you eat them, especially when you buy in those quantities. But now that you know how nutritious they are, you're going to be eating 2 at a time. That's 1. But 2, when you select the kiwis, you want to make sure that you choose kiwis that yield lightly to gentle pressure. So they're not hard as a rock. They're a little firm, but they have a little bit. They will ripen in a couple days. If they're mushy, if you can definitely have finger imprint, they are overripe. Now, you also want to avoid the wrinkles or the damp spots. So how the heck do you store kiwis? 1, if you need to ripen them, you're going to be leaving them on the counter in a paper bag. That's the old-fashioned, let's ripen them fast. Put in an apple or a banana because the ethylene accelerates the ripening. Have you ever done that with green tomatoes? Definitely helps. Now, once they're ripened, you can refrigerate up to 7 days, but you've got to keep them dry. You got to take them out of that plastic so they ventilate. But here's the other trick. You can also freeze them. Put them on a baking sheet with a little parchment paper. Peel and slice, or don't peel, slice. Thickness you want, put them on that baking sheet, stick them in the freezer. Once they are frozen, so that's in a couple hours, take them out, and then you can put them nicely in an airtight storage bag, and they won't stick to one another, which is why I always freeze them separately. Now, they can stay good up to 10 months or so. So when you find that extra big container of kiwis that's a good price, don't say no to it. Divide it in half and automatically freeze, and you're set to go. So I'm going to repeat myself here. Peel or no peel. Again, the skin is edible, boosting that fiber by 50%. And we know we need the fiber. We have the prebiotics, probiotics, and the postbiotics. And those little live things in our intestines need food, and they get their food from all different types of fiber. So we want to make sure we have enough fiber. That skin on the kiwi is edible. And if that fuzz bothers you, just take a mushroom brush and brush some of that excess fuzz off, or scrape it with a spoon just to take that, I'll call it the oral texture, sensitivity you may have, just to take that down a notch. Now, if you have digestive issues and you need to watch your fiber a little, okay, then go ahead and peel it. It's perfectly fine. Just know that you are tossing out some of those bonus nutrients. All right. I know you're here because you're interested. Maybe you're concerned about your health. Maybe you're concerned about your blood sugar numbers creeping up, and you're afraid you will be the next as a statistic for this diabetes epidemic. Sorry about that. So I've got this free guide, and it's called What Now? Questions Pre-Diabetics Women Ask. And you can go ahead and grab your free guide. The link is in the episode description, and it gives you answers to the questions most commonly asked. And those answers are practical answers that you can start making small changes to make a big difference. especially when you have that question of where do I even start to kind of revamp my diet? And you don't have to start at the beginning. You just need to make small tweaks. So go ahead and go to the description and get the free guide, What Now? Questions Pre-Diabetic Women Ask. So tonight, we're back to kiwi. For dessert, perhaps you'll slice kiwi over a little bit of Greek yogurt and a few chia seeds, and then you'll have a protein-rich, fat-to-fiber trio that steadies your blood glucose without sacrificing some of the sweetness. Thank you for joining me today with this The Talking Apron podcast. Remember, every small kitchen win is a vote in the positive for your future health. Keep showing up. I'll be right here with my apron on, cheering you forward. Bye for now.